Hello and good morning. My name's Amanda. I'm the Community Outreach Coordinator here at the Missouri Poison Center. And it is already fall. I can't believe it. The weather certainly does not feel like it's fall, but it is. And so, with that, we should talk about some of the poison dangers that come with the fall season. So, we're going to go ahead and talk about that today. So, first up is things that are for rodents, rodent bait. Most of these now are in blocks or bricks versus pellets, but there's different kinds out there. They're used pesticides that are used to kill mice, rats, and other rodents. Many of these baits are anticoagulants, which prevents normal blood clotting in mammals. And so it's similar to the medication warfarin or Coumadin. However, it's a different form of it. And they can cause bleeding if eaten on a regular basis with repeated dosage or continued dosage. There are some other types that include like a vitamin D3 causing calcium increase in the blood, or zinc phosphide, which produces a toxic gas in the GI tract. But really, the ready to use bait stations are what we see most commonly, that the bait is in a block or paste or form. Pelleted baits, the little granules, are no longer recommended or permitted to be used in the home, in the consumer home. However, there are other types of rodent baits that can be used in commercial areas, outdoor areas, and farms. So make sure you keep your original packaging so that we can help you when there is a potential poisoning. We would be able to help you with the ingredients and the potential risks. Some other measures that you can do to prevent rodents in your home or around your home is making sure that trash cans are covered. We don't leave pet food outside. Make sure your plants and brush are not too close to your exterior walls. And avoid feeding birds if rodents are a problem in your neighborhood, because they do attract as well. And so, again, make sure that we have the original packaging as well as the instructions for use with these types of products. All right, moving on maybe to a little bit more fun of a topic, which is campfires and bonfires, which we know are going to be in full swing here coming up with the fall season. As the weather gets a little cooler, it's a perfect time to enjoy a bonfire or campfire outside with friends. It is not recommended to use any flammable liquids such as lighter fluid, gasoline, or kerosene to start or to stoke a fire. Of course, that's a flammability risk. And it's only recommended to use dry newspaper, kindling, or other safe fire starters. These liquid flammable sources can certainly pose a risk to children if they unintentionally swallow or get spilled on the skin, as well as pets. And we don't recommend burning anything that is not safe to burn, such as aerosols, tires, glass, or plastic. Anything that has foam or paint. It can produce toxic fumes and potentially some fire dangers in terms of an explosion and injury. Only use kindling and wood as the main component of your fire. And that wood should not be treated wood or lumber, because we can also see some chemical issues with that. Oak, ash, or beech wood result in a longer lasting fire, and soft woods like fir, pine, and cedar often produce more smoke, which and that flammable tar that has some other health risks. All right, moving from fires to the inside, we know with fall and winter come cold and flu season. And so with that, many people will use over-the-counter medications to treat their symptoms. The common cold is caused by a virus, not a bacteria. So traditionally, antibiotics aren't used and don't work effectively. So many rely on home remedies as well as over-the-counter products to treat their symptoms. Many of these have more than one ingredient in them, and they're combination products. So it's very important to know all the ingredients that are in it. Let's say it's a cold and flu product. It contains maybe something to suppress the cough and also for pain relief. And so it is important to know that if you've taken one like that, that may have some acetaminophen or Tylenol in it, not to take additional separate pain relievers on top of that, because you can go to the excess and have a potential overdose when you take it regularly in combination with another product. It's also important to make sure these medications are stored safely. Children do tend to like the cold and cough products for the taste because they are syrupy, sweet, and often flavored. So many kids do get into these types of liquid products. So it is important to make sure they're stored up and away and out of reach of children, as well as locked up. And measuring the dose is really important. It is not recommended to use household spoons or kitchenware to measure. The safest is a syringe or dosing cup that comes with the bottle and is marked for the exact dosage. If you don't know how to dose or you don't have one of those measuring devices, it is important. You can ask the pharmacist at your local pharmacy for just assistance in checking that dose, as well as helping you with the appropriate dosing device. In the fall, we often see some new plants and foliage that's out there. There are mushrooms and berries that pop up this time of year. And as the old saying goes, every mushroom is edible, but some only once. So mushrooms, of course, are healthy. They have good high in potassium, fiber, and other vitamins. But some of the mushrooms actually can cause some minor GI upset, as well as more serious effects, say, to your liver or kidneys. And so it is very important to make sure that if you are mushroom hunting or wild mushroom hunting or foraging, that you really know your mushrooms very well, that you're an experienced forager or work with somebody who is, because toxic and non-toxic mushroom varieties can grow side by side. And there are many lookalikes when it comes out there. So make sure that you only do that if you are well trained and versed in those things. And there are lots of wild berries in the state of Missouri, such as wild strawberries, blackberries, raspberries, gooseberries, all sorts of berries. But there are some that aren't edible in terms of can cause a lot of upset stomach and vomiting and diarrhea. So it is important to know the difference there. You might recognize the berries in this picture are pokeberries, which are common in the fall in Missouri as well. So the main thing with this is just to know exactly what you are foraging or picking, and to not eat something you're not familiar with. And another topic that we will, talk about probably throughout the winter is carbon monoxide. Unintentional carbon monoxide deaths, poisonings result in over 15,000 emergency department visits each year, with over 400 deaths nationally. So if you're using something that runs on batteries or electricity, there's no risk of carbon monoxide. However, when there's a fuel source, there is. And this is an example of a carbon monoxide detector. And it's best prevention to install these detectors on each level of your home within 10 feet of an adult sleeping area. And these don't last forever. They do expire, or they're not as effective within 5 to 7 years, or when the manufacturer recommends you want to check and maintain those, as well as replace the battery and check the battery every time you change your clocks in the spring and fall, which for this year is November 2nd. So coming up another month or so, it would be a great time to test and change the battery on this and your other smoke detectors as well. If you have any signs of carbon monoxide poisoning, such as fatigue, dizziness, headache, other symptoms, it is important to get yourself and your other loved ones out of the home into fresh air and to call for assistance. The Missouri Poison Center is a 24-hour nurse and pharmacist line. We are available every day of the year, no matter what the situation is, a poison exposure, a question about a poison, or even a preventative message. We can certainly help you over the phone. I encourage you to save the phone number in your phone at this time. The Missouri Poison Center and the National Poison Helpline is 1-800-222-1222. Have a great rest of September and a happy fall.